So this will be recorded and redistributed if you registered. So I'm just going to jump right in, and if anyone joins, then we'll let them in. All right, so today this talk is all about hormone replacement therapy. It's really about who should be on it, what you should know about it. I'm actually going to be doing this in a series, so every Tuesday at 6 or 6:30, I'm going to be going over a specific topic. So today we're going to talk about what are the symptoms that might drive you to want hormone replacement therapy. We'll dip into a little bit about hormone replacement therapy. And then in the future videos, we're going to talk a little bit about the safety of it. That's a big concern for a lot of people. We're going to talk about the types and the things that you can consider, things like testosterone. That's something that people don't talk a lot about. And then we'll talk about the methodology. So how do you actually get it? So we're going to cover a little bit of all of that today, but we'll get into the more deeper dives in the future. So let's jump in. All right, so I'm Dr. Nicole Peoples. I'm a board-certified physician in internal medicine, but I specialize in hormone replacement therapy and longevity. I also practice functional medicine, integrative holistic medicine. I'm a wife of 16 years. I've got 3 children, and most importantly to this conversation, I am in perimenopause. And I don't say that lightly because it's something about going through perimenopause and menopause that changes you as a physician. And a lot of the things in my approaches may be different than some other doctors out there. And what I find is that when I meet doctors who are going through perimenopause, their whole entire perspective shifts. So just having gone through the process a little bit really opens your eyes. So I think it's a really important thing to think about when you're looking for a doctor who does hormone replacement therapy. All right, so here's the thing that people typically come to me saying, that everything is normal. And they don't feel like everything is normal, but their doctor says all of their labs are normal, but they're experiencing weight gain that they've never experienced. They have intense cravings. They're tired all the time. They're overwhelmed. They have pain in places that they never had pain before, joint pain, sleepy, sadness, depression, frustration. All of these things are happening in their bodies, and everybody's telling you that it's normal. And this is really important for us as women to understand, because you may feel like you're in an island by yourself, but as a doctor who takes care of women with hormonal issues, it's everybody. It's just about everybody who is going through these symptoms, and they are all feeling like they're all alone. But you're not alone. And we're going to talk about what exactly normal is and why we should address it potentially in a different way. And we're going to talk a little bit about premenopause, but we're mainly going to focus on perimenopause and menopause. So let's talk a little bit about what is normal. And I don't have enough time in this talk to talk about the difference between normal, common, and optimal. I like to live in a realm called optimal. What all that basically means is that we're not just looking at what's happening to everybody, but we're also looking at what should be happening. How do we optimize the way our body functions so that we don't have to experience symptoms or feel deprived? And the act of menopause is a normal process, but how we all experience it may not be optimal. So we are going to talk about what in fact is normal and then get into this optimal. So let's get some ground rules around menopause. We know that the menopause transition is this time period where you go from premenopause all the way into postmenopause. And premenopause is that time where your hormones are pretty stable, usually somewhere between the time you went through menarche, around 11 or 12, all the way until your fertility ages, which are around in your mid-20s to early 30s. But then around late 30s, a lot of women start to develop symptoms, and those symptoms are due to a decline in your hormone levels. This is really important when we talk about hormone replacement therapy, understanding that there's a natural decline. Now, this natural decline can happen for 10 to 15 years before the end of your cycle. So most women who are going through perimenopause are still having regular cycles. As you get later into perimenopause, those cycles may start to become a little bit erratic. Now, if you've never had stable menstrual cycles, then talking with a doctor about why that might be the case, even if you're premenopausal, is really important. But as you go through perimenopause, you will notice that your cycles start to change some, but also your symptoms start to change. And being able to identify your symptoms is really what's going to tell you about whether or not you're in perimenopause or not. Even your labs aren't going to do a great job. Labs are a nice addition to everything, but really it's the most important part of all of this is listening to women, listening to their symptoms and figuring out what's happening in their bodies. And talking with someone who understands that some of these symptoms are going to be things that you wouldn't expect. So for many of us, when we talk about menopause, the impression that I got, even as a training physician, and maybe what your idea of menopause was, that if you weren't having hot flashes and night sweats, then there was nothing to worry about. But the reality is that perimenopausal time frame, that 10 to 15 years before you actually go through into menopause, can be very symptomatic. We'll talk about what those symptoms are in a second, but let's talk about what menopause is. Menopause is actually just one day. It's the one day where you have gone 12 months without a cycle. Like I said, in late perimenopause, you might start having cycles less frequently. You might notice that your cycles are becoming irregular. Maybe you're skipping cycles, but eventually you're going to go 12 months without a period. And when I say we're going to go 12 months without a cycle, I mean everybody. So every woman, if you're fortunate to live long enough, will go through menopause. This is a 100% efficacy rate. Everyone is going to go through it. So once you get to that 12-month period, that is what we call menopause. And everything after that is postmenopause. But the symptoms of menopause don't just start when you stop having a cycle. You start having symptoms well before that, and that's what that time frame is called, perimenopause. So I hope that's clear. We're going to jump into it a little bit deeper in a second. But when should you start thinking about it? A lot of women start to go through perimenopause as early as 35, most women around in their early 40s, and it can last until the average age of menopause, which is around 51, 52 in America. This is going to vary from person to person. Not everybody's going to experience it the same. This is why we have to start talking about women's health in a very personalized way. So everyone on this webinar right now is going to experience menopause and perimenopause completely different. And just because yours is not the same as the next person's doesn't mean that there's not something we should be concerned about. We should be you should be talking to your physician about what those symptoms are, how they're affecting you, and what you can do about it. So this is a really oversimplification of this process, but I really like it because it helps me understand exactly what's happening in your body when we're talking about normal. So in your early teens to 20s, your hormones are fairly stable for most people. Some people may have some problems in that premenopausal state where people might have irregular cycles, PCOS, PMDD. So there are some conditions where maybe things aren't 100% perfect. But for most people, our hormones are pretty stable. Once we get into our 30s, what you're seeing here is, in the blue line is our estrogen, and our estrogen levels start to go up and down like a roller coaster. So from one day to the next, your hormones can be really high, your estrogen can be really high, or it can be really low. From every month, things may be different, maybe high and low. That is why you may feel emotionally like you are on a roller coaster. Why sometimes you feel like everything is normal, and then the next day things seem to hit the fan. And that's because of this blue line, this roller coaster of your estrogen. But estrogen is not your only hormone that is important here. As you go through perimenopause, you also see a decline in another hormone called progesterone. So that's this brown line. And you can see progesterone is just steadily decreasing as you get older, okay? And this decline also has an impact on the way you feel, look, and age. So it's also a very important hormone. Now, what's not depicted here is testosterone. Testosterone also declines very similarly to progesterone. So as you go through your 30s and your 40s, your progesterone starts to decline. So what we're seeing here is that in your 30s to your 40s, your estrogen, progesterone, and testosterone are all starting to decline. This is normal. We are all on our way to menopause. Like I said, 100% of us will go through it. So this is a very normal process. How we experience it, though, can vary, all right? How we experience these fluctuations. And so the question then becomes, what do you do about it? Now, I'm a functional medicine doctor, I'm a lifestyle doctor, so I'm always going to say there's a huge lifestyle component. All of our bodies, our metabolic health, how much we move, how much we sleep, how much our stress is, how much we weigh, all of these things can impact your health. But if you're ignoring your hormones altogether, if and 100% of us are all going through this process of hormone decline, then you're missing a huge piece. So it's important that we don't ignore hormones as a contributor to the way you may feel, look, and age. All right. So what are some of these symptoms that I've been talking about that you might be experiencing through perimenopause? Now, I'll have to say that, and I alluded to this earlier, as far as women's health goes and the medical system, we have mainly focused on the hot flashes and the night sweats as it pertains to menopause. The reason why perimenopause is getting this big push right now is because there's a lot of educated women right now who are experiencing other symptoms, and they're saying, wait, is this just me? Is it, or is something else going on? And so a lot of these symptoms that you're going to see here, you're probably experiencing and never crossed your mind that it might be hormones. And you're not alone. Even me, as a completely trained physician, I never learned any of this in medical school. I had to learn all of this after medical school. So let's talk about some of these symptoms that are very common in many of our lives that you may not have known are hormone related. Irritability, anxiety, depression, weight gain, insomnia or difficulty sleeping, migraines, hair loss, dry skin, missed periods, shorter cycles, heavy periods, painful periods, infertility, hot flashes, night sweats, urinary frequency or frequent UTIs, vaginal dryness, decreased libido, no interest in sex, bloating, joint pain, palpitations, memory loss, fatigue. There's another common one that's not on here, itchy ears, itching all the time, all over. These are some of the symptoms that you may be experiencing as you go through perimenopause. Now, some of these you look at and you're like, okay, yeah, missed cycles, shorter cycles. Yes, when I was young, I was put on birth control pills. Because of these, I knew this was hormonally driven, but the only treatment was birth control pills. And then some of them may be a little bit more shocking, like joint pain or palpitations. I don't know how many patients I know who have gone and had a full cardiac workup because they felt like their heart was racing. But in fact, nobody ever said, hey, how old are you? Maybe you're going through perimenopause. The decline in your hormones may be the cause of this. So take a good look at this. Put your check marks by any of these that you might be experiencing, and you will find that maybe hormones need to be something that you're starting to think about. So here's the thing about these symptoms. It's not just the symptoms that as a doctor I'm concerned about with women's health. The reason I'm so passionate about this topic, yes, I want women to feel better, but I also know, particularly for African American women, that we have higher rates of chronic illness. But when your estrogen, progesterone, and testosterone start to decline, guess what goes up? Your risk of heart attacks, your risk of osteoporosis or fractures, your cognitive abilities or memory, your muscular strength, your risk of depression and anxiety, diseases like diabetes and abdominal fat. These are all huge concern from a medical perspective. And as I told you in the beginning, I'm a longevity doctor. My interest is in keeping women healthy for as long as possible. So nobody wants to age and be in the hospital and be on a number of medications that they don't need or that they need to survive. You'd rather prevent that. And so from my standpoint, when I talk about hormones, I'm not just talking about hot flashes and night sweats. I'm talking about some of the long-term benefits of maintaining your hormone levels as you get older. So there is an overlap. And like I said, most of this talk is about perimenopause and menopause, but I do want to share something about your history, right? So how you experienced your hormones as you got older. And if you have children, nieces that are coming of age, this is important for you to share with them. So there are a lot of conditions that women experience early on. So things like PMS or PMDD, which is depression around your cycles, PCOS, heavy periods or fibroids, endometriosis, menstrual migraines, and infertility. All of these are hormonally driven. And women who experience a lot of these symptoms early will have worse symptoms in perimenopause and menopause. And if you have worse symptoms in perimenopause and menopause, we know that those women go on to have more chronic disease. So it's extremely important that we're addressing all of these hormonal imbalances early on. So not just you as a woman who may be going through perimenopause or menopause, but you want to think about this for the generations coming behind us, because we don't want them going through all of these symptoms without the wisdom that they should have about that experience. Like I said, as you go through menopause, all of these other diseases also go up. So there's a relationship between heart disease, stroke, dementia, osteoporosis, and whether or not you had PMS, whether you had really bad menstrual cramps, whether or not when you went through menopause, you had hot flashes and night sweats. And a lot of that's driven not just by your sex hormones, but also by your stress hormones, which is a whole other topic for a whole other day. If you guys are interested, let me know. Can you or should you replace hormones? So if the problem is, as I've described it, is that your hormones are declining normally as you get older, then it would seem to reason that to resolve these symptoms as well as reduce your risk of chronic illness would be just to replace those hormones. And a lot of women did this up until 2002. As a matter of fact, it was the most commonly prescribed medication on the market, which was hormone replacement therapy. And in 2002, a big study called the Women's Health Initiative came out and scared the living bejesus off of everyone, telling people that hormone replacement causes cancer, breast cancer, and also increases your risk of heart disease. I'm not going to talk about that study today, but in my follow-up next Tuesday or the Tuesday after next, when I do one of these, I'm going to go deep dive for you women who are really concerned about your risk. And we'll talk about all of the findings in that study. But suffice it to say that in 2002, because of that study, tons of women, 80% of women who were on hormone replacement therapy stopped. And the consequence of that, with further studies over the past 20 years have been very detrimental to women's health. So the question of can you or should you go on hormone replacement therapy is really an important one that we should be discussing and why you're here today. So let's talk about what that might look like. The way that I prescribe hormones is I use something called bioidentical hormone replacement therapy. So bioidentical hormones just basically says that we're using hormones that look identical to what's in your body. That seems logical, but that's not what we were using 20 years ago. And some doctors are still prescribing the synthetic form. And so there's a huge difference in the way that those hormones actually act in your body. If you were taking a synthetic, non-bioidentical type of hormone, they aren't identical to your body, and they have different impacts on your cells and your body. And we'll talk about that in another talk. But what you want to be taking is the hormones. You just want to replace the hormones that you had your whole entire life. That's the goal. So that's what bioidentical hormones are. And the replacement, remember, we're just replacing. We're replacing the hormones that you lost. So we want to restore balance. And the hormones we're talking about are not just estrogen. So a lot of people talk about estrogen, but it's estrogen, progesterone, and testosterone. Yes, even in women. And I actually prescribe tons of testosterone in young women who are premenopausal, perimenopausal, and postmenopausal. Estrogen is typically reserved for my postmenopausal patients, with a few exceptions, and progesterone goes for everybody as well. So progesterone and testosterone are actually more commonly prescribed in perimenopause than actually estrogen. It's important to talk to your doctor about progesterone and testosterone as well. And then the next thing you have to think about is what type or what formulation of hormones that you're going to get. So hormone replacement comes in many different forms. There are pills, like you just take orally. There are troches, which also goes into your mouth and your body absorbs it. There are topical kinds like creams and gels. There are patches, but there are also pellets. And I'm going to do a whole other talk on pellets because I love pellets, and that's one of the things that I prescribe. There's a lot of misunderstandings about all of these forms, and it's important for you as a consumer and as a patient to understand what your options are before starting hormone replacement. So when you are thinking about going on hormone replacement, it's important for you to ask your doctor, what types of hormones do they prescribe? Do they prescribe bioidentical hormones? You can get that from your typical pharmacy, or you can get it from a compounding pharmacy. We'll also talk about that in a later video, about the differences in compounding versus pharmacy. There's also this question about whether or not it's FDA approved or not. And that's also important for you to have that conversation and understand the differences. And I know it seems like a lot. I have to go into my doctor and I have to tell them what types of hormones I want to be on. I have to tell them which way I want to get it. And you do, unfortunately. And that's because many doctors have not been trained. And so if your doctor hasn't been trained, but they're willing to prescribe, you may have to guide them. This is about should you be on it and what you should be, who should be considering going on hormone replacement therapy. So the classical, again, is hot flashes and night sweats. That's what most people think about. And most doctors will prescribe hormones nowadays. Most will prescribe it for hot flashes and night sweats. But if you come in with any of those other symptoms that I talked about, they may not prescribe. They may not prescribe it for depression or anxiety. They may not prescribe it for mood swings or low energy or fatigue because they may not understand that hormones can actually benefit these things. So I always tell women, you have to have a really good understanding of what's happening in your body and be able to communicate that. So things like having difficulty falling asleep or staying asleep, unexplained weight gain, and there are lots of things that cause weight gain. Hormone replacement therapy in and of itself doesn't cause weight loss. It's important for you to understand that, but it can change the composition of your body. So it can help to reduce maybe fat deposition and increase muscle tone and muscle mass. Mood swings and irritability, and not just for women, but also for men. And I'm going to touch on men in just a second. Low energy fatigue, brain fog, indecisiveness, and low sex drive. This is just a few. Okay, there are tons of other symptoms, but these are some of the main ones that I see women coming in for hormone replacement therapy. And so what can you expect to have as a result? So you can alleviate those menopausal symptoms like the hot flashes and night sweats. Ooh, that's a great thing. But also, it can help you with increased energy. A lot of people who feel like they're waking up in the morning and they don't feel like they had a well-rested sleep, or they're dragging in the middle of the day. Clarity and focus. This one has been a huge one for so many women, particularly because we're so high functioning and we need our brains. And sometimes being in brain fog, where everything seems like you're like pushing thoughts through mud, that sensation oftentimes can be driven by hormones. So the way that your skin looks, your mood and emotional stability, and like we talked about, improving your sleep, this is a huge one. It has to do mainly with progesterone and progesterone given orally. So again, there's tricks to this. So understanding that can help with your sleep. And then also muscle maintenance. And this is a great one for testosterone and estrogen. So we also talk about the long-term benefits, this idea of should you go on hormone replacement therapy, even if you're not having any of these symptoms. So there are plenty of women, the lucky ones out there, who go through perimenopause and don't notice a thing. Your mind is working perfectly fine. You're not having any of these weird symptoms that I've discussed. But should you consider hormone replacement therapy anyway? And my answer to that is absolutely yes. So if you are going to go on hormone replacement therapy, you want to start early. You want to start in the perimenopausal state and through that transition through menopause. You want to start early, and you want to do it for other reasons other than symptoms. So we talked about the risk of osteoporosis or bone fractures. We talked about stress and inflammation, particularly around the heart. We talked about the brain. But here's the really surprising thing. Remember where I said that in 2002, all of these women stopped their hormone replacement therapy, and there were huge consequences to that. There's been studies that have shown that all-cause mortality, that basically means the risk of death from any cause, is increased when you are not when you're not on hormone replacement therapy as you get older. So just some things to think about when you're considering, should I or shouldn't I go on hormone replacement therapy? So I also wanted to put one little tag in here for men because this is something that nobody talks about. So even though women, we know, go through menopause, men also go through andropause. And that basically is a decline in their testosterone as they get older. All men do it. They're all going to decline. And there are also other factors that can increase the speed at which that testosterone declines. So it's important that if you have a significant other, a brother, a father, and they may be experiencing some of these same symptoms, right? It's not just women who are emotional. All y'all know that. Irritability, loss of energy, blunted motivation, loss of muscle mass, increased weight, particularly around the midsection. So we've all seen as men get older, they tend to hold weight around their midsection as well. It's just not stigmatized the way it is for women. Loss of confidence and focus. So these are some symptoms that a man may want to seek out for testosterone replacement. So that's just my one little plug on men, and I will do a whole other talk on men as well. So what should you do now, right? Now that you have some of this information, I want to give you a couple of options on how to proceed. So the first is I'll be doing these talks every Tuesday. So show up. Like I told you before, I'll be talking about should women be taking testosterone, talk about does hormone replacement therapy cause cancer, but also what are the risks and benefits of hormone replacement therapy. We're going to go deeper into men and the use of testosterone, and then we'll also talk about pellet therapy. I'm open to any other topics that you're interested in. This is a series that I want to keep going because I really feel like women need to understand this process before they can commit to being on hormone replacement therapy. But I do want to open it up for questions if anybody has them, because I love questions. You guys shoot. I'm going to leave this screen up just for a second so you guys can take a screenshot or scan it, and then I am here for questions. You can either type them if you don't feel like, oh, there are some things in the chat. Let's see. Hey, Sheila.
Hi, I
Um,
have a question when you're ready.
I am ready.
Okay, so I have an autoimmune condition. I have Graves' disease. Is that something that you can help with?
Absolutely. So thyroid is also it's also a hormone, and it's included in the hormones that we talk about. And thank you for bringing that up, because I should do a talk specifically on hormones. But here's the thing about all hormones. They all play in the sandbox together. So if your thyroid is off, it doesn't matter what I do with your sex hormones. So thyroid is usually the first thing that needs to be addressed. Now, with Graves' disease, this is where your thyroid levels are high. There's not much that I can do, even from a functional medicine standpoint, for that. You typically will need definitive treatment, which is usually an ablation, or you have to remove your thyroid or something more drastic. But then that throws you into hypothyroidism, and that's where thyroid replacement comes in. So it's important that if you're going to have those procedures, that you are replacing your thyroid with a combination of both T4 and T3. This is just the types of hormones. Oftentimes, the standard of care is just to give T4, which is the inactive form, but a lot of women don't do well with just T4. And so again, this idea of listening to women, understanding their symptoms, and understanding whether or not your treatment is actually effective, and being able to make a shift if it's not. If there are some people who do well on Synthroid, who just do well on that one, and for those women, just like with anything, if it's working, it's not broken, don't try to fix it. But there's so many women that it's not working for. So yes, thyroid is a huge part of this process.
Perfect. Thank you. I will reach out.
Absolutely. Any other questions? Let me see. So for those of us who had a hysterectomy before menopause, how do you explain the timing of menopause? Okay, so with hysterectomies, there are a couple of things you have to think about. Whether or not you retained your ovaries or not. If you took out your ovaries, which I don't advise unless you absolutely need your ovaries out. So there used to be, I think it was up until 2008, when women would go in for a hysterectomy, they just take your ovaries just because, who needs ovaries? But it's really an arcane way of thinking. It's like we don't take out men's testicles for any reason. Why would you take out the ovaries? So it's a partial hysterectomy, which means that you've kept your ovaries, which is great. The issue there, though, is that we know that when you take out the uterus, you clamp down on the blood vessels that go to the ovaries, and you can actually throw yourself into early menopause. As a matter of fact, most women who have hysterectomies or partial hysterectomies go into menopause early. So then the question becomes, how do you know if you're in menopause? Because now you don't have a uterus, you're not going to start bleeding. And this is a question not just for women who had a hysterectomy, but also women who've had ablations, who are no longer bleeding. Also for women, and this not so much, but I'll throw it out there, for women who are on birth control pills and their periods have stopped and they've maintained their birth control pills well into their 50s. And they're like, I don't know if I'm in menopause. So what do you do in that situation? There are several different ways people might address this. The way that I address this is listening to the patient. What are your symptoms? What is your age? We also do some labs that can give us an idea of where you are, specifically something called an FSH. But those numbers can fluctuate. So it's not just the labs, it's the combination of labs and symptoms that we are concerned about. Either way, at some point, if you are concerned about the things that I mentioned, not just your symptoms, but also the heart benefits, the bone benefits, the brain benefits, the all-cause mortality benefits, at some point, you are likely going to go on hormones. So we'll just have to decide as a team when that time period comes. But for most women, regardless of whether or not you're in menopause or not, Progesterone and testosterone can be added at any point in time. And then estrogen can be added when you're in perimenopause. It's really just a risk assessment about where we think you are and monitoring to see what happens. If you have too much estrogen from 1 month to the next, you may have some bleeding, but that's all treatable. So there's not a definitive, like, you have to know exactly when you would normally go through menopause before you can start hormone replacement therapy. You're welcome. Any other questions from anybody? I hope this has been helpful. I encourage you guys to, I'm going to make myself, I encourage you guys to reach out to us if you have questions. Thank you guys for showing up, and I will hopefully see some of you guys back next week where we talk about testosterone. Good night, you guys.